Hi, this session is about the anesthesia section of the CPT manual. So this is part of our CPC training or the basic certification training module. We should know the word meaning of anesthesia. So let's break it down as an plus aesthesia. Aesthesia means sensation. So whenever the prefix ad is being added, we would say like absence of sensation. So whenever we say a patient is anesthetic, means he does not have his senses. Okay, let's go on to the various types of anesthesia that is being administered by the healthcare providers. And you should understand one thing, there are CPT codes that have separate listing as with and without anesthesia. Say for example, the patient is coming for a chalazion excision and we have different codes whether the patient was given anesthesia or not. Accordingly, the coder has to select the code because anesthesia procedures are normally given by the anesthesia providers. We should know what are the types of anesthesia. First thing that we have is a topical anesthesia, or which is very much being given by sometimes by the application of ointments as well. Next comes a local. Say the patient is going to have his tooth being extracted. In such case, a local anesthesia is being given to that particular organ of concern or the anatomic site of concern. Next, we are going to see like something called as blocks. We have this metacarpal blocks or the metatarsal blocks and the digital blocks. So a physician is going to do a procedure on the fingers. At that time, he is going to give a digital block. Next comes a regional block. In a regional block, what happens is a particular organ or a region is being sedated, okay, so that the patient does not feel any senses of those organs. Say for example, the patient is being given a regional block on the right lower extremity. His right lower extremity does not feel the senses.